Healthy Conversations is made possible through a grant from the William L. and Ruth T. Pendleton Memorial Fund.
Hi everybody, my name is Niki Tomitz, and I'm a speech-language pathologist here at Dignity Health Yavapai Regional Medical Center. I have been an SLP for about 5.5 years now. I started my career in inpatient rehabilitation, and I came to YRMC about 1.5 years ago. I received my master's degree at Northern Arizona University in 2016, and I'm proud to say that I specialize in swallowing and swallowing rehabilitation. So I am here today to talk about what speech-language pathologists do and what we can offer to the community here at YRMC. An SLP working in healthcare specializes in speaking, listening, reading, writing, thinking, and swallowing. So I would like to dive a little bit deeper into all the different disorders that we can treat and the conditions that come along with those. If any of these sound like you or a loved one, please feel free to reach out and we would be more than happy to help you. So as I said, speech-language pathologists are responsible for the evaluation, diagnosis, and treatment of speech, language, and swallowing disorders. SLPs often diagnose and treat the following disorders on this slide: ALS, Alzheimer's or dementia. We don't diagnose that, but we can treat it. A variety of cancers, including head or neck cancer. We work with people who are recovering from COVID-19, dysphagia or swallowing disorders, multiple sclerosis, non-traumatic brain injuries, traumatic brain injuries, Parkinson's disease, strokes, and a variety of voice disorders. So what do we treat? What do we cover? The first thing we cover is aphasia. Aphasia is a language disorder, usually the result of a stroke or a brain injury, that makes it difficult for people to speak or find the words that they want to use, comprehend or understand what other people are saying, read, write, or use numbers. So it makes it difficult for people to do math in the real world after they have this type of condition. There are 9 different types of aphasia, and it would be really important to see your speech-language pathologist to figure out what kind you have and how we can best help you. We also treat apraxia. Apraxia is a motor speech disorder that affects the muscles of the lips, the tongue, the palate, and it impacts the clarity and the consistency of a person's speech. You may notice that when your loved one or yourself has this condition that they're often groping or fighting for the words, and that they don't come out very consistently. I always tell my patients it makes you predictably unpredictable. We also treat what are called cognitive communication disorders. The hallmarks of a cognitive communication disorder may be memory loss, changes in your thinking skills such as decision-making, problem-solving, your organization. You may find that you have changes in your vision, whether that's double vision or neglecting part of a visual field completely. They may have the inability to focus on what they're doing, and they're highly distracted. These problems can come from a variety of disorders, including strokes, brain injuries, but we also find they're present in people who are recovering from cancer, especially if they had chemotherapy. You may have heard the term chemo brain. It's absolutely true, and it's something we can help you with. As you will see on this slide, we can also help people with their speech. So we can help people who have dysarthria, which is a condition where the muscles in the mouth may be weak or too tight. It may cause slurred or inconsistent speech. This is often one of the most common disorders after a stroke. But we can also work with people who have voice disorders, where their voice may be higher, lower, too loud, too quiet. It may sound hoarse or strained. So our clinic here at YRMC boasts 2 specialized type of scopes that all of our SLPs are qualified to use, who would be more than happy to take a closer look at your voice and develop an individualized treatment plan for you. And then finally, my personal favorite, we treat swallowing disorders. Swallowing disorders are when people have trouble chewing, swallowing. They may find that they're coughing frequently when they're eating or they're drinking. This can lead to what we call aspiration, where food or liquid is getting into the airway. That may result in frequent respiratory illnesses or pneumonias, and also lead to other related health issues such as malnutrition or dehydration. People with this disorder will often claim that it is hard to get things down or that things are sticking in their throat. Those are absolutely not normal symptoms of aging, and it's worth coming to get checked out. Here at YRMC, we have 2 specialized, objective ways of measuring your swallow, and we would be more than happy to take a look at you. This is a very common problem in people after a stroke or a brain injury. You may also find it exists in people with degenerative diseases such as ALS, multiple sclerosis, Parkinson's disease, and as people age, it may also be present in dementia. A little bit about speech-language pathologists. We are key members of the healthcare team. We are specifically educated and prepared to evaluate adults with speech, language, and swallowing problems. We are the only career with a master's degree or higher in these areas, which makes us the preferred provider to help you recover from them. We have the in-depth education and experience for these specific disorders, as we have to complete a master's degree, a fellowship, and have so many continuing education hours a year to remain relevant in the field. If this sounds like you or a loved one, please feel free to reach out to your doctor for a referral. We are at both campuses, West and East. Our staff boasts 3 full-time SLPs who would be more than happy to help you. Okay, now we'll take some questions. Yes, absolutely. There's an old myth that there was a 12-month cap on rehab where people wouldn't progress from that point. That is absolutely not true. People have been shown to make progression for up to 10 years or more after a stroke. So come on in and see us. We would be more than happy to figure out what we can do for you. So the main part of our role in caring for people with Alzheimer's or dementia is to provide assistance to their loved ones and their caregivers. As we know, Alzheimer's and dementia are progressive. If you come in early enough, we can give you strategies and things to work on, knowing that it will progress, but we can also set up those same strategies with you and your family to make the progression as smooth as possible. We can also help you anticipate problems with your eating and your drinking that can help you for years to come. For example, the patient who may have Alzheimer's or dementia, as the disease progresses, they may have trouble chewing and swallowing, or even problems with their appetite. And we can play a role in helping the caregivers of those patients come up with strategies and ways to help make sure their loved one doesn't get malnourished or dehydrated. Yes, absolutely. One of the beautiful things that came out of the COVID-19 pandemic is teletherapy. If you're not comfortable with leaving your home or you're not able to, we can absolutely set up a Zoom teletherapy session where you can work with us from the comfort of your home. If we need anything to be sent to you beforehand, we can send it to your house or we can email it to you. And then it's just as if you were coming into my office working face-to-face, and we can set up your individualized treatment program from the comfort of your home. Yes, the best way to see us is to go to your primary care physician and ask for a referral. We have a very close working relationship with all of our doctors here, and they would be more than happy to send you to us. On this slide, I've included our contact information for both Prescott and Prescott Valley. If you liked today's talk and are looking for more information, please feel free to visit yrmchealthconnect.org for more interesting topics.